very good news. A new huge randomized double-blind placebo-controlled trial shows that vitamin D supplementation is significantly reducing the risk of developing autoimmune diseases. There were a lot of epidemiological studies suggesting an association between vitamin D and the risk of developing autoimmune diseases, but epidemiological studies are just suggesting, they are just associations. Now, this paper published in BMJ, in the prestigious BMJ by Manson and Kostenbader from Harvard, from the School of Public Health of Harvard Medical School, shows that in 25,871 participants older than 50, the consumption of 2,000 units per day of vitamin D is reducing the risk of developing autoimmune disease by 22%, significant reduction. Instead, the omega-3 fatty acid 1 gram per day alone does not significantly reduce the risk of developing autoimmune diseases. So this is very, very important. So I suggest you to go to your doctor and ask to measure your vitamin D level, and if low, to start to use vitamin D supplementation to raise your omega-3, your vitamin D levels. If you are in Florida or Arizona, or during the summer, or when the sun is strong, you can, as I'll show you in a second, you can use the sun to produce enough vitamin D. And again, you should just measure, regularly the vitamin D concentration to know if the sun or the vitamin D supplementation is adequately increasing your vitamin D levels. So let me very quickly showing you the figure 1 of this very important randomized clinical trial. You see that those randomized to vitamin D, 2,000 units, they have a significant 0.05 reduction in autoimmune disease. And for omega-3, instead of the P is 0.19, so it's not significant reduced. And in summary, just to summarize again the message, in this large primary prevention trial, supplementation with vitamin D at a dose of 2,000 units per day for approximately 5 years, alone or in combination with 1 gram a day of omega-3 fatty acids, led to a lower incidence of confirmed autoimmune disease than placebo. In contrast, supplementation with omega-3 fatty acids alone did not significantly lower incidence of autoimmune diseases. When only the last 3 years of the intervention were considered, the vitamin D group had a 39 fewer participants with confirmed autoimmune disease than the placebo group, with a P of 0.005, while the omega-3 fatty acid group had 10% fewer participants, but not significant, 0.54. It was not significant. So very good news. Again, you should elevate your vitamin D levels in your blood, because not only is going to protect your bone, as you know, vitamin D is essential for bone health, for the reabsorption of calcium from the kidney and the intestine, the gut. It has other beneficial effects. But again, in the randomized clinical trial, it has an immunomodulator effect in reducing your risk of autoimmune diseases. Now, let me very briefly explain you how you can get vitamin D from the sun. This is the chapter on sun exposure and vitamin D that I wrote for my book, The Path to Longevity, published by Hardy Grant. And as you can see, page 192, I discuss the importance of sun exposure for vitamin D, but not only for vitamin D, because more and more data are suggesting that sun exposure is increasing endorphins and many other important molecules that are important for bone health, cancer prevention, autoimmune disease prevention, psychological, mental well-being, and many other factors. So a moderate exposure, and I explain you in a second, to sun is healthy. Okay, so I don't have time to go through this one, but as you may know, Professor Michael Olick, that is one of the top world expert on vitamin D and sun exposure in the world, publishing very high impact factor journals, thinks, and I agree with him, that we should maintain serum 25 hydroxy vitamin D at least of 30 nanogram per ml. So go to your doctor and ask her to measure your vitamin D. If you have levels that are lower than 30, you should either expose your body, face and hands is not sufficient, to achieve this level of 30 nanogram per ml at least. You should expose your arms, legs, and ideally your abdomen and back. So basically you should be in a swimsuit 2 to 3 times a week to sunlight until your skin gets a little red. Okay, so typically, depending on your skin, it takes probably 5 to 15 minutes 2 to 3 times a week to obtain on average 15,000 to 20,000 units of vitamin D. That's fantastic, so it's again, let's say 15-20 minutes is enough, of sun exposure, and then stay away from the sun, because excessive sun exposure and sunburns are bad for your risk of developing skin cancer and melanoma. But again, some very well-planned exposure to the sun is very healthy for you, as this new paper published in BMJ shows. A 22% significant reduction in autoimmune diseases with 2,000 units of vitamin D per day in a huge, large 25,000 plus randomized clinical trial. So I hope that this information is important to you, and I hope you can use this information to change your lifestyle. And again, if you are living in a country where during the winter sun exposure is not possible or limited, then you have to take vitamin D according to your vitamin D circulating levels in the blood. Thank you, as always, for listening.